Hello, I'm Cara Grant with Montgomery County Public Schools, Maryland, the largest school district in Maryland, 14th in the country, and I am the pre-K through 12 supervisor for health and physical education and adapted physical education.
And hello, my name is Nick Thompson. I work for Wicomico County Schools as supervisor of physical education, health, family and consumer sciences, and we are on the Eastern Shore of Maryland. As you know, physical education and physical activity is linked to mental health. In Wicomico County recently, we studied over 4 years of data that showed the relationship between how students perform in academics in school related to physical activity. We will be discussing how and why physical activity and physical education can be prioritized in schools to support mental health.
As you can see on the slide provided, physical education and physical activity are integrally linked to help students with their mental and emotional health. Physical movement, moving the body, helps the brain and helps mental and emotional health tremendously. How can we prioritize this to let students know, one, to receive the instruction, a standards-based instruction in physical education and health education, to let them know that this is what is important and how the mind links with the body movement. We have some system-wide examples in Montgomery County Public Schools through the Be Well 365 program, where we use the WSCC model and really coordinate efforts with other groups on that model, like school psychologists, school counselors, providing students with physical education as the goal of getting them the education they need so that, one, they can physically move through the day, but two, that they can connect the improvement to mental and emotional health.
And in the next slide, we will be discussing how physical education and physical activity is prioritized to integrate mental health and during the response to the pandemic. Suggested actions to integrate mental health in response to the pandemic. First, we discussed we offer standards-based physical education programs that is equivalent or greater than what was offered during the pandemic. Provide physical activity opportunities that students can engage with family members virtually outside of school hours and in the community.
And really what we're talking about is thinking through and creating new ways and processes for students to engage in physical movement post-pandemic, as well as continuing successful implementation of the physical education program standards-based. So what we are doing is creating summer opportunities for physical movement that are free for our students in Montgomery County Public Schools. We help link them up with pay-to-play models in their community through the Parks and Recs program, highlight parks in local areas, and even the playground at their school so that they can use in the summer. The field space that is at their school in the summer, getting out to go to the swimming pool, go fishing, do other kinds of activities where they're physically moving as they engage in summer, as well as during downtime after school. But during school, we focus on coordinating school efforts with MTSS, which is the multiple tier supports and systems. Physical education is a tier 1 support because every student is receiving physical education in their pre-K through 12 career. In some districts in Maryland, they're receiving this annually, pre-K through 8, they're receiving it annually. And then in high school, they have the opportunity to receive it annually if they elect to have PE electives through the course of their freshman through senior year. Our non-diploma bound students also receive this as well. The tier 2 and tier 3 really come into like coordinating efforts with mentoring programs based with physical activity, intramurals, athletics that students can link into, as well as more systemic approaches around psychologists and counselors linking and coordinating efforts for wraparound services. The goal truly is to education and physical activity first because it is critical in providing students with instruction on how to move and how to link and understand that moving helps your mental and emotional health.
In summary, continue to advocate for physical education and physical activity in your schools and your community, and be cognizant of the efforts that all staff in the schools can put to this to improve the health and well-being of all students and staff. Thank you for listening, and we hope you find these recommendations helpful in prioritizing physical activity, physical education to support mental health in your schools.